Hi from Chicago. Welcome. It's the Sports Doctor. I'm Dr. Bob Wiel, sports podiatrist. All things sports medicine, fitness, and wellness. Brought to you by Global Schoolwear, school uniforms by Tommy Hilfiger, Lower Extremity Review, LER, and MVP Parent Magazines, UK Health Radio. Quick shout out, my old medical school colleague, Paul Scheitel. The 23rd of September is the Step Out Walk to Stop Diabetes in various cities. Keep and pay attention. We've got a great doubleheader today. Katie Blanchard, she is a doctor of physical therapy, sports, and the Schroth Method of Scoliosis specialist. She's joining me along with Dr. Robert Kornfeld. He's a podiatrist, functional medicine specialist for chronic foot ankle pain. Then the sports doctor's in with some Bob Guida wisdom and your emails. Katie Blanchard, welcome to the Sports Doctor.
Thank you so much, Dr. Bob, for having me. I'm excited to be here.
Katie, give us some background on yourself and leading to your specialty in the whole world of scoliosis treatment.
Sure thing. So I started out as a physical therapist focused on sports rehab. I have a little bit of a background with sports, playing basketball in college at Dominican University in River Forest. So that started out as my focus as a PT. You know, sports medicine, ACL tears, you know, foot and ankle, hips, all of it. And now that I'm, 5 years into my career as a PT, I've shifted my focus, and now my specialty is treating kids and adolescents with scoliosis with something called the Schroth Method.
And give us some details, again, on number one, scoliosis. How common do you find the condition, and how helpful is physical therapy and strengthening? We've always seen that very, very important, proper shoes, proper support. Tell us a little bit about this, the Schroth Method with scoliosis.
Yeah, so scoliosis is actually a lot more common than you would think, especially in kids and adolescents. It's something that usually kids aren't born with, but it starts to develop when they, hit the age between 10 and 15 years old. And it's called idiopathic scoliosis, which means that we don't know the cause of it. We don't know the root cause of it. Although there may be sometimes a family history of scoliosis in the family. But usually there's around 100,000 kids in the U.S. are diagnosed with scoliosis each year. So it's a lot more common than you'd think. And there's a conservative method to treating it, which is called the Schroth Method. And it's a technique in the physical therapy profession that when coupled with bracing and things like orthotics, like you said, it tends to be very effective when we can find scoliosis early in kids before it gets to be too progressive.
Do you find that, for example, either a very flat-footed child or a child with very, very high arches, do you find any consistency with some of those foot imbalances with the commonality of scoliosis?
Yeah, definitely. In a lot of my patients that I see with scoliosis, we analyze them full body. Just because I'm a specialist in scoliosis doesn't mean that I only look at the back and the spine. So we look at everything along the whole chain. So looking at the feet, the foot and the ankle, we tend to see in kids with scoliosis something called foot pronation, which means for our listeners that the foot likes to kind of collapse inward and that the arch isn't as supportive as we would like it to be. And if you think about if the foot rolls inwards and kind of collapses inwards, that causes effects going all the way up the chain to the knee, the hip, and even to the spine. So, foot pronation and, having a good supportive foot can definitely help with
now, of course,
the condition of scoliosis.
Pronation is a normal motion. When it's excessive, pronation allows us to absorb shock. It allows our feet to shape to the ground when we're walking. Once we bear weight, ideally, pronation shifts to a term called supination, where the foot lines up to push us off, almost like a spring mechanism. Scoliosis itself, Katie, how often is it symptomatic with actual back complaints and concerns?
Yeah, so most of the time for kids and teens, it is asymptomatic. And that's why it often goes untreated or unnoticed in kids and adolescents, that population. Or, people live with it their whole life, and then all of a sudden they're in adulthood and they start to have back pain. And then they realize, oh my gosh, I may have had scoliosis my whole life without knowing it. So in kids, the population that I treat most, it is usually pain-free. They're functioning kids who play sports, do activities, and are living great lives. And it's just something that is a little hiccup in the road that we want to, nip in the bud and make sure that we can treat early on so it doesn't get worse.
And, of course, you're looking to strengthen everything surrounding all those areas and the lower extremities, and working a lot of balance. So the Schroth Method, as I've seen some examples that I was taking a look at what you were talking about, you're really, again, talking about the importance of strengthening all of these supportive systems involving strengthening, stretching, and other methods, aren't you?
Yes, correct. And actually, one of the most important aspects of treating scoliosis method is actually a breathing technique. And because kids' spines are still pretty flexible, they're still growing, their spine is not rigid like an adult spine would be, we use a breathing technique to help open up the concave side of the spine, which is the side that it tends to be a little bit more collapsed on the back with scoliosis. And that's because scoliosis is a 3D condition. It's not just a side bending of the spine, which is, a myth. Most people just think, the spine with scoliosis, it's either S-shaped or C-shaped. So it goes to the right or to the left.
There's a rotational component, big time, isn't there? We're going to ask you more about that. Everybody listening to The Sports Doctor. I'm Dr. Bob Wiel, sports podiatrist. If you go to my website, sportsdoctorradio.com, you can go to radio shows. You go back years, international guests, national guests, local guests, a myriad of topics in sports medicine, fitness, and wellness. If you go over to newspaper articles and magazines, you'll read a lot of excitement with MVP Parent Magazine, Lower Extremity Review, and subjects that run the gamut from concussions to what's the best shoe, to one of my still most popular articles, which is Women in High Heels, Accepting the Challenge. So you can check that out. We're talking with Katie Blanchard. She's a doctor of physical therapy specializing in dealing with scoliosis. I find that a very interesting fact that I wasn't aware that, the condition develops as a child grows. It's not necessarily something that somebody is born with. And the idea, Katie, that you can get improvement and some type of lessening of the development of scoliosis the earlier you catch this, how early are you looking at these kids?
Yeah, so I see the youngest I've seen in the clinic is around 6 years old, and that's, you're really lucky if you can catch scoliosis early on at 6 years old. And then, I see kids, teenagers up until they're 18, 19, 20 years old, but we're usually catching it, between the prime growing years, anywhere between 10, 11, and 13, 14 years old.
Is pediatrics paying enough attention to screening? I have my own complaints about whether or not they're doing enough screening with foot mechanics and balance and stability. But it seems that many of these go unnoticed because there aren't necessarily symptoms. So I would imagine that the education side and the screening side is a big part of what you do.
Yes, for sure. I try to go out into our community here and do scoliosis screenings, during, community fairs or at schools, that sort of thing. But the good thing is we're seeing a better job being done by pediatricians with yearly screenings, the yearly checkups that kids are going to their primary doctors for. They're starting to do what is called the forward bend test, and they're paying more attention to it and looking for the signs of scoliosis. But another good thing is, I think parents are becoming more aware of how their child looks. So, the end of summer is coming, and you feel maybe taking your kid out to the pool. They're walking around in a bathing suit, shirt off. That's the time where, as a parent, you can look at your child's spine and you can see, does it look like maybe one of their shoulders is a little bit higher than the other? Does it look like they have, maybe a little bit of muscle bulk on one side compared to the other? Or do they just have, posture that doesn't look ideal? And that may be, a flag just to bring them into your pediatrician or into your local physical therapist where they can look a little bit deeper into screening for scoliosis.
What's the best website for people to find out about information of you and the Schroth Method?
Sure thing. My company is called Schroth Boss. That's SCHROTH Boss. And so my website is schrothboss.com. And you can also find me on both Facebook and Instagram, as well as YouTube, where I provide a lot of free information and exercise tutorials.
Where do you find, like, the chiropractic profession with all of their spinal expertise, soft tissue massage? How does that fit in, for instance, as well as what we were always concerned about, with scoliosis, the contest was always, what about leg length? What about any kind of lifts, for example? What's your experience as whether, along with physical therapy, for example, chiropractic care might be helpful?
For sure. For chiropractic care, there can be a big stream of, variation in chiropractic. And for scoliosis, what you want to focus on is more working on the soft tissue with massage or stretching, that sort of thing, not necessarily manipulation, because when we look at the spine of scoliosis, it already has some rotation in the spine. And what we do when, you go to a chiropractor and you have a manipulation done is you're inducing more rotation in the spine. So we want to avoid manipulation, but we advocate for soft tissue work, massage, anything that might help with balancing of the musculature.
Is it necessary, like you're talking about clinically, being able to take a look, whether it's at, shoulder height or whether the spine looks, that maybe it's curvature or something, that boy or girl's posture. And then, of course, X-ray becomes necessary, right?
Yes, correct. So scoliosis is diagnosed first and foremost with an X-ray. And once an X-ray is done, anything with the curve being greater than 10 degrees is considered a positive diagnosis of scoliosis. Anything less than 10 degrees is not considered scoliosis per se.
Of course, one of your major objectives, and it makes so much sense, is to prevent the necessity of surgery, right? To try to make a difference early. And again, when you've seen, some improvement in staying out of trouble, it's got to be a great goal.
Yes, for sure. The whole goal of the Schroth Method in physical therapy for scoliosis is to, stop the progression of the curvature. Because when kids are in their prime growing years, they have more risk of scoliosis getting worse and worse. And so if we can just stop it from getting worse, then we're going to help prevent spinal fusion surgeries in the future. So that is the first goal, first and foremost, to stop the progression. And secondarily, if we can get a little bit of correction in the meantime, that is an even bigger win.
And the idea, again, of being able to, how often or how long a treatment regimen, I would imagine this is ongoing therapy, almost like an athlete would be following. It's not like we have treatment and we're done. This is something that would be progressive as far as while that child is maybe going through puberty and developing.
Correct, yes. So, as they're growing and developing, the treatment is going to change a little bit as their body changes as well. But in general, I usually see my patients from 8 to 12 weeks, usually twice a week, to really teach them the custom and specific exercises for their specific spine. And then once they learn the exercises, I want them to be independent. And I want their parents to be supportive in them and being independent in doing their home exercises.
So you're giving them,
that,
you're giving them a really powerful home program in order to progress. I knew the time would fly by with you. Give me that website again, Katie, before we run out of time.
Yes, so the website is schrothboss.com, SCHROTH boss.com.
Okay, Katie Blanchard, Doctor of Physical Therapy and specialist in the world of scoliosis. Thanks so much, Katie. Hold on. We'll be right back, everybody. It's the Sports Doctor.